Good evening. What can you tell us about the Catholic Church's position regarding the Liverpool care pathway?
The Liverpool care pathway, now on version 12, contravenes Catholic teaching. The Church decrees that nutrition and hydration, even by artificial means, are forms of natural care and are not removable clinical treatments, even though it has ostensible safeguards which may appear to protect a patient's access to fluids. Arbitrary, ambiguous discretionary terms, like in the patient's best interest or not detrimental to patient, mean that any clinician, diagnostic team or, after a prognosis, any of the medical staff may remove hydration, bearing in mind the normative use of hyoscyalusine. Anti-nausea drug for end-of-life patients is also a desiccating agent. Removal of fluids will reduce the effectivity of pain relief drugs, as organs and muscles begin to necrotize, the patient dries to death.
Thank you. But what does the Church say about pain relief towards the end of one's life?
Catholic teaching is that opiates for pain relief must be needs-based and must not unnecessarily sedate anyone in their final hours. Pius XII in his 1957 speech to the anaesthetists said unnecessary sedation of patients is a barbaric, deplorable practice. It is repugnant to Christian sentiments and is ultimately gravely evil. The Liverpool care pathway has prognosis-based opiate provision rather than needs-based pain relief. This can lead to unnecessary sedation and deny the patient the opportunity to die a good, pain-limited, optimally conscious natural death. Continuous deep sedation is rapidly becoming normative practice.
So Catholics are taught: 1. Do not remove fluids, and 2. Don't sedate unnecessarily by over-prescribing painkillers.
But opiates don't merely relieve pain or sedate. For non-cancer patients, Trescott in his 2008 study and Gomez in 2011 revealed that this unnecessary opiate use actually accelerates death. This contradicts what our bishops' conference said on the issue in their end-of-life document, where they said morphine doesn't hasten death. Plainly and simply, the bishops got it wrong. This is a serious issue. This directly contravenes the fifth commandment, thou shalt not kill. Morphine is euthanizing non-cancer patients.
So, from a Catholic perspective, as a form of palliative care, the Liverpool care pathway is irrevocably flawed. It is the Liverpool care pathway's use, not just its abuse, which is directly contrary to Catholic teaching.
Yes, and even more so, it is directly contrary to Catholic teaching on the sanctity of human life in one particular way, when it begins irreversible end-of-life procedures after a 72-hour prognosis. To quote a leading contributor to the Catholic Medical Quarterly, once you are on the Liverpool care pathway, you will die, even if you weren't dying. We need to face the truth that the LCP is a form of backdoor euthanasia.
Anthony Cole, chairman of the Medical Ethics Alliance, has also expressed grave concerns on the LCP.
Yes, he argues there are hardly any circumstances where fluids need to be withdrawn, that opiates become more toxic, consciousness is impaired, and the suggested morphine doses are too large for the frail and elderly, that there is no provision for a truly independent second opinion, and, as the audit showed, informed consent is virtually ignored to the extent of non-existence. There is also no required training for anyone applying the LCP, who are very often inexperienced staff. Plus, there is no certainty of determining the imminence of death, especially in the elderly with multiple pathologies, especially given the amount of post-mortems revealing death by different causes to the presumed diagnosis. Plus, difficulties will arise in this procedure from a lack of continuity in care. Dr. Cole tells us, what is virtually certain is that inexperienced, untrained staff will be stopping fluids and giving powerful drugs with lethal effect. Relatives will be ill-informed, suspicious and sometimes embittered. The LCP should be used with great care by trained experienced doctors humble enough to listen to a truly independent second opinion. No doubt it has a place in hospices, but to roll it out in all settings will lead to many premature deaths. The natural death with consciousness to the end should always be sought for spiritual and family reasons. The LCP does not exclude this, but the circumstances I have already mentioned will lead to premature unconsciousness, intoxication and hastened deaths. Finally, Dr. Cole leaves us with a devastating prediction. Palliative care itself could be discredited and it could play into the hands of proponents of euthanasia.
But some senior Catholic ethicists strongly support the Liverpool care pathway, don't they? Saying it conforms to Catholic teaching and that those who oppose the LCP are scaremongering and playing into the hands of the pro-euthanasia lobby.
Let me explain. The Liverpool care pathway is backdoor euthanasia. But Catholic ethicists, medical and charity quango professionals, senior clerics or Catholic commentators, even pro-life activists, are denying it is euthanasia, and dismiss every concern and seek to suppress any opposition to it. And we have to ask why they are so hostile. The answer is they want to save more lives. They don't want active euthanasia legislation passing through Parliament. They recognize that if they say the LCP is euthanizing, it will make it easier for the pro-euthanasia lobby to argue for euthanasia being a regular normative medical practice in the NHS, and thus make pro-euthanasia easier to become law. As this is a long drawn-out form of passive euthanasia, a system aimed at reduction in pain and suffering would logically, especially in these days of overriding human rights and financial restrictions, seek to introduce assisted suicide, direct active euthanasia.
The irony.
From the frying pan of the thousands euthanized on the LCP to the fire of the hundreds of thousands euthanized through active euthanasia legislation. Yes, they are terrified of the consequences, which is why they are silent. They are afraid that trying to save the lives of the few might very well kill the many.
Which is why we have at present in this country a conspiracy of silence on the LCP. A whispering campaign against Orthodox Catholic and Christian ethicists, healthcare workers, commentators, activists, bloggers, etc., especially those with high positions in the medical profession, who prove categorically and irrefutably that patients are being euthanized and murdered in unbelievably excruciating pain and distress. And why?
Because, like Caiaphas, the high priest of the Gospels, who said it was better for one man to die than the nation, thus refusing to defend the innocent Jesus as the price was too high for the people. The argument is that it is better for a few thousand to die through use, misuse and abuse of the LCP than for the law to be changed to assisted suicide and active euthanasia, leading to the deaths of millions. This present formal cooperation with evil by willfully denying the immorality of the LCP, the murder of patients and the deliberate campaigning against those who seek to reveal it being backdoor euthanasia, is beyond repulsive. It's redolent of silence about the trains going to Auschwitz.
So what should Catholics do?
If Catholics are to sincerely, authentically claim to be defenders of the dignity and sanctity of life, we must strongly oppose the Liverpool care pathway, demand an immediate government investigation into this institutionalized genocide of our weak and vulnerable. We must contact our bishops, our MPs. We must express a vociferous solidarity in defense of our neighbor, one which guarantees that no one is given a death sentence for utilitarian, ideological, eugenic or financial motives. A palliative care that guarantees needs-based provision of care and opiate provision with the absolute principle that nutrition and hydration are forms of natural care and not clinical treatments, which may be withdrawn. If we deprived a pet animal of water and let it die of thirst, we could be prosecuted and thrown into prison, yet every 4 minutes we remove the hydration tubes from one of our neighbors until they die of thirst. not from their illness. And we call it dying. With din.
It's evil, isn't it?
Yes, it's evil. And the evil is increasing because good men and women are staying silent and allowing this evil to happen. It can't go on. It must be stopped. Now,
We must do something.
say to ourselves, I have a chance to speak out to save their lives and in the process save my life, and my conscience, and maybe my soul too. Because I know there may come a time when there may be no one left to speak for me.
Exactly. Thank you.